the way, and that will go for at least another 2 weeks. It seems like everyone, for the reasons we're just talking about, are feeling more anxiety these days, and that includes children.
You're right, and in fact, it has reached the point that an influential group of health policymakers is recommending children be screened for anxiety disorders. Dr. Frank McGeorge is here to explain why this recommendation is even being made. Frank.
Yeah, Kim and Devin. So, developing an anxiety disorder during childhood or adolescence actually increases the likelihood of a future anxiety disorder. And partly due to the pandemic, there's increasing evidence that early detection and treatment can really make a huge difference for the rest of a child's life.
Well, I think the mental health is health. So it's just part of what I would think is part of the pediatrician getting to know their patient.
That's Eric Herman, a clinical psychologist at Children's Hospital of Michigan. The U.S. Preventative Services Task Force just issued a draft recommendation that all kids over 8 be screened by their pediatrician for anxiety disorders.
Anxiety disorders are probably the most prevalent among the kids that I see. So I think it's pretty big problem.
The hope is that improved primary care screening can lead to earlier treatment.
Cognitive behavioral therapy is one of the most used treatments for childhood anxiety. But you hope by identifying it early and getting treatment early, you help people gain skills as children that later on that follow them throughout their lives. It all depends on the kids. Some is very specific. Some is it got to do with, an anxiety disorder that's profound. And then these people are going to have struggles with anxiety throughout their lives. Sometimes when things change, going from junior high to high school to college, any major stress, they're more at risk. So it all depends on the person, but learning these skills is good for everyone.
And that really is the goal, to intervene early and teach kids the necessary coping mechanisms to prevent problems down the road. Now, incidentally, most often this does not involve the use of any medication.
Well, that's good. Well, Frank, you mentioned that the pandemic is partly responsible for a lot of the anxiety doctors are seeing. Do you think it's going to get better as things return back to normal here?
Well, Kim, that's kind of a yes and no. The pandemic really just worsened and uncovered many of the underlying problems that have always been there. So when things go back to normal, on the surface, things may look better, but the underlying tendency of a person toward anxiety is still going to exist. It's just going to tend to become more manifest at times of change in a child's life, where now, honestly, it could be almost any day.
Sure. Yeah, really good point. Okay. Dr. McGeorge, thank you.
You and I were talking last night about how much bad behavior we're seeing.
In adults, right.
I think it's very much attached to the anxiety.